Like he was 21 last time he was in the military.
All right, Tim, we ready?
Yes, sir.
Okay. All right, we on?
We're rolling.
All right, welcome to the Blueprint.
Yes, sir.
I'm your host, Joel. That's my co-host, Ant. And we are joined by Dr. Ebon Bourne.
Really?
I did it wrong, didn't I?
Really? Did we just?
I did it wrong.
All right.
I said Evan.
Evan
Evan.
Ebon Bourne. E-B-O-N Bourne. With an E on the end.
Special guest.
Right, special guest, Dr. Bourne. Wellstar,
Thank
right?
you.
Wellstar,
Thank you.
doctor.
Yes, sir. Wellstar.
Okay, so tell us a little bit about yourself.
So I have been, it's hard to imagine, but I've been a practicing internist now for almost 20 years. Makes me feel old as old can be. But 20 years, and started out kind of doing some hospital work, as I was telling you gentlemen, and kind of transitioned into my own private practice, and then kind of jumped around, did urgent care for a second, and then wind up back here in Atlanta. And I say back because I went to Emory.
Okay.
So coming back to Atlanta was just like coming home, and I've been with the Wellstar Medical Group for now about 10 years.
Okay. So the reason we wanted to have you on is because so many of the guys that come in here, suffer from different issues.
Sure.
Like Ant was saying earlier, one guy was saying he hadn't been to the doctor since he was in the military.
At the age of 21 when he got out.
Right.
And he over 50 or 50.
So how important are annual exams?
Yeah, I think annual exams are key, right? And I mean, I think you have to put it in the right framework. So an annual exam for young kids is obviously very important. Mm-hmm. Then we get into a phase where, you're maybe in your early 20s, you're in college right after, and you feel great. Everything's, going well. You ain't got no medical problems. Everything's cool. So the general rule of thumb is like somebody in their 20s should probably have an annual exam if you follow the guidelines at least 20s, at least 2 times, right, in your 20s. Okay. 30s, okay. You want to say maybe 3 times, right? And then in 40 and up, you start doing more regularly. But in reality, I think a lot of us push for an annual exam at least every 1 to 2 years. Because let's be honest, a lot of things can change pretty quick.
Yeah.
Right? Blood pressure issues, cholesterol issues, all the things that plague not only everybody, but especially us as a black community. It's important to kind of stay on top of those things. So realistically, even though I'm an internist and my patients are only like really 18 and up, I start checking cholesterol right at that age. Because we're seeing it in, high school kids, high cholesterol. Wow. So super important. To me also, it's kind of like getting your car checked every now and then. Right? Even if it's just preventative maintenance, even if it's running fine, you're still going to want to take it in and get a checkup.
Right. So, I would imagine when you first started as a doctor that, say, checking someone's cholesterol at that young age probably wasn't a thing, or was it?
Right. So, I think what we've seen in the last 10 years, 15 years is that some of the issues that typically were adult issues are now starting to transcend to a younger generation, right? And I think a lot of that is stemmed by obesity. I think a lot of that is stemmed by stress, depression, anxiety, all these things. So what we typically saw as adult problems now are being seen younger and younger. Right, one of my family members is a pediatric endocrinologist, so they deal with like diabetes in kids, and she said it's rampant, and it's rampant because of the obesity in kids.
Yeah.
Right.
Yeah.
So, and it really even happens for people in our 40s. So people that heart disease and heart attacks and stuff like that was grandma and grandpa had. Now we're seeing in 40-year-olds,
right,
50-year-olds. Right? Everything is just kind of moving younger, unfortunately.
Yeah. We are more stationary than ever, I believe. from the kids to grown folks, they play the video games all day.
Yeah.
We're not getting out getting fresh air anymore. You know.
I mean, you think about it, right?
It's a lot
So think about it. You know, growing up, the first thing I wanted to do when I came home was go out on the street and play ball
Right.
every day.
Same here.
And I mean, I think that's kind of, if we're all in the same age group, that's kind of how we grew up. And I don't see those things now. Kids play sports in school, right? If you're on a sports team, but when you come home, what are you doing? Right? The device has been the downfall
Yeah.
of stuff. It started, I think, with video games, but now it's a device too.
Device too. Yeah.
And folks are just so much less active than we used to be before. And I mean, I can name so many different disease states, from hypertension, high cholesterol, obesity, cancers, colon cancer in particular, other cancers in females that are directly linked to being inactive and being obese.
Yeah. Yeah, like a study we were just talking about earlier. A study is saying, but 44% of black men are overweight.
Yeah.
44%.
Yeah, that's huge. It's almost half.
Yeah.
That's amazing.
It's almost half. So
Which means we're not living longer
it means that our life expectancy is lower already.
already.
Life expectancy is lower already. And you know, and what I like to stress to my patients, and especially my patients of color, is that we gotta be very diligent about these things. We gotta break those stereotypes and do things that we may not have necessarily done, right? So for example, my family comes from a Caribbean background, and like some of the family members, the older family members, exercise was like a foreign concept completely. Like, exercise, what are you talking about? You know, if I have to walk and go someplace, that's my exercise. No, that's not really exercise.
Right.
Walking just to do your normal life things is not exercise. So we have to kind of break out of that mindset that exercise is a them thing and is not a me thing.
Right.
And you know, the funny thing is, right, so you quote me that 44%. I think that number is high, but I think that there are so many things that we could change to bring that number down. The power's in yourself to do it,
Right.
right? By adapting. I used to use the term habits of health. And what does that mean? Exercising more, being a little more intentional about your diet in terms of what you're putting in your body. I mean, what you put in is what you're going to get, right? Be intentional about what you put in your body. Manage your stress. That's a huge one.
That's the
Well,
side
we'll get on that.
Okay.
Yeah, we'll get on that. Managing your stress. Making sure you're getting adequate sleep, right? Avoiding tobacco, avoiding excessive alcohol, avoiding the drugs. All those things, man. I mean, these are things that not only our community, but people do to themselves that definitely lead to some of these statistics.
Right. Right.
Mm-hmm.
So when it comes to us as black men, why do you think that so many stay away from the doctor?
Joe, I think that's something that there's not one actual reason. I think if you were to dig back historically, there is, I'm going to put it out there, there's probably an inherent level of a little bit of distrust
Absolutely.
in the medical system, right?
Absolutely.
People like to refer back to, to Tuskegee and experiments and
Right.
and different things. That's the one that's widely known, but people have an inherent level of distrust of medicine and it's based upon some of these things. I think also there is traditionally medicine has been a predominantly white male dominated business, right? And I think certain patients, and this is important because I talk to patients all the time, you have to be able to feel that you can connect with your doctor,
Right.
with your provider.
Yes, sir.
Sometimes it's based upon ethnic or racial lines. Sometimes it's based on gender, right? But if I'm entrusting my health to somebody else, I want to make sure that I feel like I have a relationship a little bit with that person. And I think that's that has been a big piece that steers sometimes people away.
So that brings me to another question. Is there an advantage for a person of color to have a doctor that's also, a person of color?
So I mean,
Like,
I think that there are some advantages.
Yeah.
And I can't generalize and say all the time that that's the best situation, right?
Right.
Because I mean, you got majority doctors, you got female doctors that relate very well to male patients and vice versa. So I can't say that. I think the bigger thing, more so than just the racial, is the connectivity.
Right.
And being able to feel that if I'm talking to you, that you can leave that visit and say that, okay, at least Dr. B understood me and understood where I was coming from.
Right.
And not necessarily just has no connectivity to me whatsoever. Because there's plenty of majority doctors that I think do that very well. I think a big challenge that we also have, and I didn't even get into it, I think a big challenge that we also have is not letting, as doctors, our biases affect how we deliver care.
Yeah.
And that's a big one, right?
Right.
That's been studied and seen a lot in, if you look at data in hospital admissions, right? If somebody comes in with a heart attack, who gets what type of treatment, right? Are we looking at the insurance? Are we looking at the socioeconomic stuff that's going on? How are we deciding who gets what treatment? Who goes and gets a medicines only, and then this one goes to the heart lab and gets a stent placed? So I think doctors, we all have to do better at working at trying to break down our own biases in terms of how we look at different patients when we come in. And it goes both ways.
Right.
Right.
I can look at a patient who I feel like, oh man, this guy's coming in from the sticks, and have my own bias towards him, as he may have towards me.
Right. Yeah.
And I didn't even get into the whole idea about insurances. So you said why there's some of these disparities. If you don't have health insurance,
Right.
and you don't have a means of paying, because I'm going to be first to tell you, healthcare is expensive. If you're just trying to pay out of pocket, healthcare can be very expensive, and you may wind up rationing what you do.
Yeah.
Right.
You may say, I'm only going to go get checked up if I feel sick.
Right.
Yeah. So
Yeah, that's one of a lot of reasons we don't go to the hospital too, because we can't afford it.
absolutely. I mean, if you're really having to think about, am I going to put food on my table for myself and my family, or go get a checkup? The checkup, I can tell you, is a few $100. And then if I'm a female and I have to go to the gynecologist and do a few more $100 there, then I got to get some labs done. Then I may need to get an x-ray or mammogram. I mean, you're coming out of pocket pretty heavy,
Yeah, it is.
right? So, I mean, that's a whole nother ball game in terms of like the insurance thing. But and then inadvertently what winds up happening is a lot of these patients wind up using the urgent care and the ER as your primary doctor, right? Just to get basic stuff.
Yeah.
Right.
Yeah.
So, do most doctors? Because for those that don't know, Dr. Bourne is me and Ant's primary doctor. So I think one time,
These guys, my two best patients,
yeah,
right here.
Yes, sir.
I'm trying to think. It was something with the lab work came back one time, and I think it may have been maybe a student doctor that was there. He came in before.
Yeah.
I can't remember what it was, but anyway, he was like, "Oh man, this is high," so I was panicking. Like what? He was like, "Oh man, you know, it may have been I can't think what it was." But
Like
anyway, when you
kidney level
came,
or something, yeah.
when you came in, you were like, "Oh, well, this level, for African Americans is typically higher."
it's typically okay.
So I was like,
Yeah,
man,
yeah.
I was like, but it made me think like, okay, if I was maybe at another doctor's office,
Right. And I've seen that.
he didn't know that
And
maybe
I've
he
seen
didn't
that.
have a lot of black patients.
I've
I
seen
could have
that.
been in trouble.
I've seen that. There are definitely certain things that we run a little bit different, right?
Right.
So, for example, when you get a chemistry panel done, which kind of looks at the internal organs, the liver, the kidneys, da da da. When you look at that report, they'll say value for African American, and then it'll say non-African American, and it'll
Okay.
have different reference ranges.
Right.
Right? A lot of times, African Americans have more dense bone structure and bone mass and things of that nature, so, and muscle mass, and it may throw those numbers off a little bit so that they're not the same. So realistically, you have to look at it, and now we're starting to see that a lot of the labs will put on there the different ranges for different ethnic groups,
Right.
so you can make sure. But yeah, I mean, there have been plenty of times where even early in my career, I saw a number there, and I had to consult with somebody, my senior, and say, "Whoa, what's going on here?" And they're like, "Oh, yeah. Blacks and Hispanics and people of color, black and brown people, can run higher in this number,
Right.
and that's okay."
Okay.
I think that takes experience
Right.
to learn some of that.
Yeah.
So the BMI chart be off then on a lot
That was
of
my
people.
question. That
Because a lot of people got big bones. They
BMI,
say.
man. All right, so
They big boned.
here's the thing. So these guys know I got a BMI chart on the back of every door
Right.
in the exam rooms that I see. And people
For those
say-
who don't know, what's BMI?
BMI is body mass index. Okay, so basically it's a relationship between your height and weight, and it kind of goes upward as So if you're 5'8", your ideal weight should be between this and this, and it goes up incrementally. And don't ask me exactly what that number would be, right? But so it goes up. So realistically, you have zones between like 25 and 30, then 30 and up is considered obese, and then when you get to 40, it's morbidly obese, and this kind of works its way up. So when patients inadvertently look at me and say, "Oh man, doc, I'm like massively obese and this and that," but so we know that those BMI scales, those tables, were made years ago in a very non-diverse group of people, probably up in the Northeast. I believe it was out of either Boston or someplace like that. I definitely was Northeast. And it was not gender diverse. It was not racially diverse. So I can't use that table and say that everybody is going to have this BMI, right? This doesn't work that way. But there are certain absolutes on there where I know when I cross a BMI of 30 that the chances of health problems start to go way up. Mm-hmm. When I get to 40, it's very significant, right? So there's certain still ranges where I tell people, yeah, you're not going to get to 25. You're not going to look or feel healthy at 25. But I don't want you at 35 either.
Right.
All right? I think it kind of puts you in the ballpark.
Okay.
Okay.
Yeah, something to keep in mind though. But, bone structure, muscle structure, do you work out a lot? Do you just different things. What's your ethnicity? All that stuff makes a difference in terms of bone mass
Okay.
and how it's measured on that scale.
So big bone is real.
Big bone can be real.
Wow.
Not saying that it's necessarily at some point big bone. You gotta be like, look, man, you gotta get it together.
Right. Yeah. Some people I'm thick. No.
Yeah.
Not no more.
At some point, you gotta be like, I don't know.
You got big bone.
That health is gonna catch up to you.
Right. Okay, so let's talk about one of the major things in our community, which is prostate health.
Yeah. Yeah.
Things have changed because every people got guys joking here or whatever. Oh, you went,
Got the finger.
got the
Got that finger.
Right.
Who did it? A dude or a girl?
Right.
Who got the finger?
Oh, you was going back every day. So, but things have changed now. So is that still?
So it's confusing, and I know where you're going with this because it's confusing to even those of us in medicine. And I think you have different guidelines that are put out by different organizations, right? So you may have the American Medical Association, then you may have the U.S. Health Preventative Task Force, then you may have the Academy of Urologists, all right, who say different things. So there's no one right answer. I think what we have seen in the last few years is more doctors now relying on using the PSA, which is a blood test, okay? So it's simply a blood test to monitor prostate health for just average screening men, and not necessarily doing the finger examination as much. Now, I caution that because somebody watching this is going to be like, that's not what my doctor does. But there are plenty of situations where people who may be deemed to be at higher risk may want the finger examination in addition to, right? And we'll get into what's higher risk. So there's no one answer for every patient. In our practice, I have now told patients, and I think the best thing to do is have what we'll call shared decision making. So if I talk to you about it, I'm like, hey, so here's my way of thinking about prostate blood tests. I like to do it on men over this age. Black and Hispanic men where prostate cancer may be higher, I usually move that back a little bit and say, you know what, I want to get a baseline somewhere at least after 40, and then maybe skip a few years and then get it again closer to 45, and then skip a few years. So everybody has their algorithm,
Okay.
but I think universally, if you're using the PSA blood test, you probably want to at least be pretty regular about it after the age of 50. Okay? So, but the problem with the PSA blood test is that it's not accurate. It's not as accurate. And the finger exam is extremely subjective, so that's not as accurate either.
Time out, Doc.
Right.
Time out. For
Talk
a
about
second.
it.
You doing this? That's scary, man.
That's that finger, man.
Ain't no,
That's that
I'm young, man, but this.
So when I do that, it's because we're getting real technical now.
Okay.
But
yeah,
when you do that, you're feeling over the top of the prostate.
Okay.
That's why that finger's doing this.
I'm being serious, man. My heart beating fast. I said, this man do this one more time.
He did like a windshield wiper. Like
No, we ain't doing it like this. Whole arm up in the No, we ain't doing that.
Oh, man.
It's more like this. All right. But yeah, so the reality is, yeah, I tell guys that prostate blood test is inaccurate, and that's why you'll talk to some doctors who don't even do it
right.
at all.
Okay.
Because it can be high for prostate cancer, which is what you're looking for, but it can be high for prostate swelling, which is what a lot of men get, called BPH, benign prostatic hypertrophy. It can be high for prostate infections. It can be high for a guy who has a lot of sex. All right, so there's a lot of reasons that PSA number could be high. All right, so the reality is then, how do you come up with a way to screen? And I think the PSA is one of the few things that we have, and watching it on a regular basis is key. If you go to a urologist, they're going to always want to do what's called a digital rectal examination every time.
Okay.
Right.
And that's what keeps a lot of guys from coming to the doctor for fear that, oh man, I'm going to go in there and it's either going to be a dude or it's going to be some younger nurse kind of, student who's giving me the finger exam. And it keeps guys away.
But which is worse, the cancer or the finger?
Right?
Right.
Exactly.
The little finger or the big finger?
Exactly. I mean, so the I don't think it's even a question. And cancer in Georgia has a very high rate. So prostate cancer is high.
Oh, really?
Right? And there's the different coalitions working towards that. I was active with a group in my church, and I believe that the some of the numbers in guys over the age of 50, maybe a little later, was like 1 in 7.
Oh.
Right? So prostate cancer is high.
Yeah.
Man.
And I'm seeing it in younger guys. That's why when you hit 40, I'm going to say always, I want to get a PSA at least to see where we're at.
Right.
And do the weight have something to do with it? Since we are more
Yeah.
obese than
So,
ever.
yeah. So, and prostate may be one of those cancers. I know for sure colon is. I'd have to double check on prostate, but obesity has something to do with it.
Okay.
All right. So just, the obesity factor has a lot to do with just everything. Just everything bad. And yeah, I'm happy to hear that.
What are some of the conditions that can improve just solely by just losing weight?
Big ones, man. So I think the obvious things are things like, well, maybe not so obvious, but blood pressure for sure. Mm-hmm. Lose weight, blood pressure gets better. I think diabetes, all right? So there have been studies done looking at, in different countries, and probably done here too, where you look at patients and you say, all right, this group, I'm just going to put on a medicine for diabetes. This group, I'm just going to tell you to lose 10 to 15 pounds. And then we're going to measure at the end of 3 months, 6 months, A1C, right? That's a number that tells you about diabetes. We're going to measure that A1C and see where these groups land. And there have been plenty of studies to show that they're equal. Medication versus moderate weight loss, right? So diabetes is a big one. Cholesterol is a big one, all right? So hypertension, diabetes, cholesterol. And then there's some other things that we don't even really think about that could be made better right away. So some people suffer from something called sleep apnea, right? Where pretty much it's a condition where you stop breathing at nighttime, right? It can be dangerous.
I had it for a little bit. I had it for a while. I lost a little weight, got rid of it.
And it got so that's a classic example right there. You lose weight, sleep apnea gets better. Yeah. Another one is joint pains, right? Chronic, arthritis on weight-bearing joints, the knees, the ankles. You lose weight, those things get better. Chronic back pain, right? And a lot of our surgeons, a lot of my surgeon colleagues, if somebody goes in and needs a procedure for like a knee or a back or whatever, they'll say, nah, you know what, you need to first lose 50 pounds or lose, 30 pounds
right
before we're even going to touch it.
Yeah,
I have a client.
Right? Because they know it'll make it better.
Right.
Yeah, you've seen it, right?
Yeah, I have a client like that. He didn't do it though.
He didn't lose weight.
Nah, so he got to get surgery. Anyway.
Yeah. He had to have weight loss surgery?
No, he got to get
have surgery on the knee.
Knee and hip replacement.
Yeah. And that's why too we're seeing so much weight loss surgery, right? My brother-in-law is a weight loss surgeon, and he's busy because this is and realistically, it's a problem that plagues the black community, but it now plagues everybody.
Yeah,
it plagues Americans.
Yeah, we so
Let's
distracted. We distracted now.
We're distracted, man. We don't walk. We eat wrong. We eat on the go. We eat rushed. We eat the wrong, like the fast foods and stuff.
Yeah, I don't hear a basketball in my neighborhood.
You don't hear it?
I don't hear a basketball or nothing at all. Bikes, nobody ride a bike. I didn't know there was so many kids in my neighborhood till I saw the school bus.
Yeah, because they're not outside.
They're not outside.
That's the issue. Yeah. So, we got to do better in terms of just really working to make sure we stay healthy. It's interesting. We traveled a few years ago to Europe, and for a while there, it was funny because even my kids were like, "Man, you're hard pressed to see some overweight people here."
Really?
Because I think people walk a lot more.
Oh, okay.
And people are active a lot more. Don't get me wrong; people still got devices. But I think the level of activity may be a little bit better. And maybe some of the eating habits may be a little bit better.
Yeah.
It's funny how when people move to this country from other countries, especially like Asian or African nations, they develop the health problems that we have here at the same rates that Americans do.
Yeah.
So like colon cancer and some of these other malignancies and things like diverticulitis and colon, all these problems are very low in certain other countries. When those people move here and take up an American lifestyle, an American diet, they get those rates of problems at the same rate that we do.
Yeah, our food's that bad.
Mr. Vegetarian.
Yeah.
So vegan, is it hype or no? What's your take on it?
So So people always ask me, is vegan, are you healthier if you're vegan?
Right.
And I don't think you can just answer that question by saying vegan is necessarily healthier. What I can say is that by following a vegan or vegetarian, let's say vegetarian, vegan, vegan is different.
Yeah, I'd say plant-based.
Plant-based.
That's why I say
So do you do any meat products at all?
no meat products.
Nothing. Not fish, not
Nothing.
chicken,
No,
nothing
no,
like that.
No
Eggs?
dairy, no eggs. No.
Okay, so that's vegan.
Yeah. Okay. I see.
Yeah, I think you're doing vegan.
Okay.
So vegetarians throw a few other things in there and stuff. So I mean, so people ask if is it a healthier lifestyle? What I can say is, on average, patients who are pretty diligent about that have a slightly longer life expectancy than somebody who eats diets high in meat and such. And I was looking into it, and it was like a 6-year versus like 8-year maybe difference, men versus female.
Okay.
All right, in terms of longevity.
Right.
And I think a lot of that can be explained by the antioxidant properties that you're getting from eating all these fruits and vegetables and stuff, and the lack of saturated fats and things that we know cause heart disease and diabetes, et cetera, et cetera. The caveat is you got to be able to still get your proteins, right? Because some people do stuff where they all of a sudden now are becoming more malnourished because they're not getting any proteins.
Yeah, and I don't understand that because I believe they may not eating enough greens or chickpeas. We know chickpeas.
Yeah,
So greens and chickpeas, they have all the
proteins
you need. I think education-wise, people don't know what to eat.
And I think you could probably enlighten a lot of the folks listening in terms of how you decided to do that and what you've noticed as a change. Because not meaning to cut you off, a lot of people do it just to say they want to lose weight.
No, it was
right?
it was a life change for me. You being my doctor, my cholesterol was high for a couple of years. And I said, I can't come back to you again to have high numbers. But since then, since I started, I have dropped probably between 50 pounds.
Yeah.
About 50 pounds. So it's a good thing. But I do feel better when I eat clean. I remember before becoming a full-time plant-based person, I did it for some months, and then I go back to meat. I can tell the difference.
Mm-hmm.
I feel a lot heavier when I do eat meat,
Mm-hmm.
eat dairy. Dairy just don't feel right at all on me. Gassy eating a lot of this food. It's a big difference when I notice when I do eat meat instead of just eating greens or a bunch of salad.
Do you feel that your energy is better?
Absolutely.
Everybody says that.
Absolutely. It's a lot.
Everybody says that their energy is so much better when they make those changes.
Yeah, and then like I'm fasting now. Like tomorrow will be another day. I do a whole day fasting. I do intermittent fasting, so it's a lot easier. And people say they say it's more expensive eating just fruits and vegetables. To me, I think it's not, because you're not gonna eat that much. Your stomach gonna shrink, so you're gonna consume less foods. That may be the reason why people not get enough protein, because their stomach is shrinking.
Mm-hmm.
I believe so. They're eating less foods. You got to make yourself eat a lot more.
So I'm gonna flip it up on y'all a little bit and now ask you the questions in terms of not only why you wanted to do it, because I think you answered that, but how do you keep it interesting? Because I mean, I think even as a physician,
Mm-hmm.
a lot of patients have that concern that, am I going to get bored if I can't have meat products?
No, I'm creative, first of all. I'm very creative. But I can cook a little bit too. So I can really cook.
You cook?
I can make everything. But it's a lot of stuff.
He claim he can.
You ain't say nothing about them vegan brownies you ate. Oh, no, you didn't even eat them.
I ate
What
them.
you eat?
I forgot what it was. It was some kind of sweet. Something sweet.
I can make desserts and all. It's not boring at all. I know how to make. I started a garden too because of this last year. So it's a lot of hobbies you can do. Come up with this plant-based lifestyle. But I started a garden, which is a hobby. But on Instagram, YouTube, you can find different recipes. I bought recipe books. But I don't make a lot of stuff from scratch, like tomato sauce, ranch dressing. My wife even came up with some mushroom crab cakes. Tastes like crab cakes.
So she's doing it too.
No, she ain't doing it. But she do it sometimes. She fasting with me. I think, but she coming along. She will join me soon.
That's cool.
But
I think though what you can say though is that it definitely takes some preparation.
Yeah, absolutely.
Yeah, that's the key.
You can't just jump in and like I'm off to work, and I'm at the shop cutting heads, and then I need lunch. And I think though, to our point, we were talking earlier about more places are selling, meatless products, which is good, but it still requires some preparation.
Right, absolutely. And I think it's much easier than people think. It's a lot of restaurants do have vegan options. Chipotle have a good salad. You can always do Chipotle. Mexican restaurants, you can find something somewhere. And like if you just want some fries and a salad, just to start off, eat some French fries, even though it's fried, but a little bit at a time till you get to where you want to get to. You don't have to just go strictly vegan. Take your time, try it a couple of weeks, then a few months, and then let the process begin.
Yeah, that's good. I'm proud of you, man, because I can totally tell the difference.
Yeah.
He's much healthier now, y'all. Yeah. I'm telling you.
My cholesterol
his numbers
is high.
Yeah, he's much healthier. So, yeah, that's good.
I'm proud of you, boy.
Yeah, this year, I appreciate it. But this year's been the lowest. I've been under the whatever the margin is for cholesterol. For the first time, I think, since I met you.
Yeah, that's good, man.
Yeah,
that's good. Yeah, it's key, man. Those are the things, And
I cut back on beef, but I'm still eating salmon and turkey.
But so the thing is, too, man. A lot of people have that misconception that humans need to eat meat.
Right.
In order to be strong and in order to be healthy and all that. So not true.
Right.
So not true. And a lot
that's
of people
the first thing that people say.
Opposite.
That's the first thing people say. Well, how you gonna get your protein?
Yeah.
They don't believe that you can get.
But how the animals get protein?
Right.
Exactly.
Yeah. I think for me, for a lot of people, and I'm sure you've heard that, is that documentary, What the Health, was like revolutionary for.
The What the Health, and then there was a few of them that spun off that, right?
Yeah.
Like Forks Over Knives, and
absolutely.
And there was another one too. I can't remember, but yeah, I think that really kind of opened a lot of people's mind to whoa.
Right.
Yeah.
Yeah.
Uh-huh. And even on a small scale, I can't say that I'm to the extent that you do things, but have done through my church. I've done a Daniel fast. A few times.
Yeah, that's what kind of helped me start off.
Yeah.
And I mean, the funny thing is, realistically, even though I still don't do that on like now, but when we did that, my wife and I did it. I mean, after a few days, I was like, oh, I'm like more clear.
Right.
Like my energy level was up. It just felt different, and I can say it felt better.
Right.
Yeah.
Yeah.
And it's the sort of thing like you look back sometimes like, why don't I do that more often?
Yep.
Yeah.
Just to clean your system out.
Yeah.
Yes, sir.
They say you need to clean your system at least once a year or twice a year.
So I think the thing is, when you say clean your system out, because people ask me that, like, should I do like a colonic or should I do a cleanse or whatever? Mm-hmm. And I think if we were to adopt healthier, more plant-based diets, you are cleaning your system out on a much more regular basis anyways. Right. So you may not need to buy some sort of colonic or cleanser to kind of flush things out, because your body's not designed to keep all this extra waste in your colon and your intestines. Right. So healthy diet right there will definitely help, because people say they go to the bathroom more when they're on that type of diet.
Right. Yeah. I normally have to poop after almost every meal.
I'm telling you, that's normal.
Yeah.
Right.
That's normal, right? So you should. There's a normal reflex that when food hits my stomach, it should stimulate me to go to the bathroom.
Yeah.
But if I'm laden up with meat and burgers and
Right.
ribs and all the
Yeah.
things we like to eat, it's not going to happen the same
Right.
way.
My football coach in high school got me off of pork because he said, I don't know why it stuck to me, but I think he said ribs take a week or two to digest out your system. And for some reason it clicked.
It's stuck.
I ain't had ribs of pork since like '99.
That's good, man.
So that was easy for me. But I used to love chicken. Chicken was my thing.
Yeah,
Fried chicken.
yeah, man.
But now I fry mushrooms that taste like chicken.
Hey, so you hit on a good topic that I think we need to mention is also colon cancer
Right.
screening and what that is. And I think it came to light a lot with Black Panther dying
Right.
from colon cancer.
Right.
I think he was like 43 or something.
Yeah.
Yeah,
he
he
was
was
young.
young. He was very young.
So,
And he'd been dealing with it since.
and he's been dealing with, so he got diagnosed even younger than
Right.
that.
Yeah, I think
about
about
it, right?
38,
Yeah,
37.
he'd
Something
been
like
dealing
that,
with like
yeah.
4 or 5 years.
Yeah.
So another one that is extremely important and is high on that cancer list and high in us. So and some of the same risk factors that we've spoken about: sedentary lifestyle, obesity, alcohol, bad diet, family history. Right? There's certain genetic things that can kind of predispose you to that also. So there's a lot of risk factors for colon cancer, but screening is the key thing. And when I say screening, I'm typically referring to colonoscopy, right? So there's also been a lot of debate as to what age do you start doing colonoscopy?
Right.
And it used to be 50 for everybody, right? And then some years back, we started saying blacks and Hispanics, we moved that to 45, right? And then we started saying, well, maybe it should be 45 for everybody. So what we've adopted in our practice, and I see more people doing it, and GI doctors, gastroenterologists doing this too, is saying 45.
45.
45. The tricky part can be making sure that you can try and get it covered under your insurance, right? Rather than doing colonoscopy, just paying out of pocket. But 45, because colon cancer, guys, if you catch it early, it's very treatable, right? And colon cancers usually begin as little polyps, which are like little almost look like little mushroom kind of things, right? So they kind of little growths inside the colon, and if you check it and you see that and you biopsy it and you get rid of it completely, the chance of that thing turning into a colon cancer is slim to none, right? And then the doctor's probably going to want to check it again 3 years later, 5 years later, based upon the type of polyp. But I think that's key. And I think that's one that a lot of people put off and don't want to do it, and
Right.
et cetera, et cetera. So
So we talked about the
Yeah.
finger as far as prostate. What's the procedure for checking colon?
So for checking the colon, I think there's a few different ways that you can do it. So I tell my patients that the procedure that I prefer the most is called colonoscopy. Right? Colonoscopy involves drinking a liquid, which a lot of people feel is the worst part of the whole thing. You drink a prep that cleans you out completely. All right, completely cleans you out, so that the specialist can run a skinny camera, probably not much wider than this, and check that whole colon,
Okay.
right? And they check the entire colon, and if they see that there's a problem there, they can biopsy it and send it to the lab and say, all right, Ant, this is nothing to worry about. Repeat this colonoscopy in 10 years, okay? The other ways of doing it are, some of you may have seen those commercials for something called Cologuard, where they mail you a box at the house, right?
Yeah.
If you ever see it, it's called a Cologuard test. They mail you a box, and you collect a stool sample at home, right? It packages it up into this little box. It sounds funky when you say it, but it's done pretty neat. And then you mail it back to them, and they check for DNA, which is in colon cancer. So it checks for DNA that's in colon cancer or in those polyps that would be high risk for colon cancer.
Okay.
Okay? The problem with that is that if you do that test and it's positive, you now have to do colonoscopy anyways.
Gotcha.
Right? Because I've just told you, hey, Joel, something's wrong.
Right.
And I don't know what's wrong.
I gotta check
so
it
now
out.
I got to check it out anyways. And then the other testing that's available is something called a FIT test or a Colt blood test, where the doc may give you little cards, and then you go home and you wipe a sample off of toilet paper onto this card, fold it back up, take it back to the lab, and it looks for the pigment that's in blood.
Okay.
All right. So it's the least accurate and has to be done. If you're using that as my method of screening for colon cancer, that has to be done every year. Right? If you're doing the Cologuard, mail that box back, it's like every 3 years. And if you're doing the colonoscopy, it's like every 10 years, if it's normal.
So what's some telltale signs that you may have some colon issues?
So the biggest thing I tell people to be aware of, the thing that weighs heavily, is if mom or dad or brother or sister or some other first degree relative said they had colon cancer early, you want to get checked early.
Okay.
All right? So usually we'll tell people 10 years younger than the person who was diagnosed. So if I'm 49, right, my kids need to get checked at 39.
Okay.
Okay? Not wait till 50 or 45 or whatever. Some other signs, though, may be, big ones would be changing your bowel habits. Blood in the stool, right? You go to the bathroom, you see blood, that always should trigger somebody checking you out.
Okay.
Abdominal pains could be a big one. Weight loss unexpectedly. I'm not trying to lose weight, but I'm losing weight. That's a big one. Fatigue, right? So fatigue is so general that, everybody's fatigued, but you feel excessively tired. The tiredness could be because you're losing blood on the inside, and now you're anemic, and that's why you feel tired, right? So, symptoms like that just something doesn't seem right.
Yeah.
Or you go to the bathroom and you normally have a normal bowel movement, right? If we're going to talk real, you have a normal stool, and then all of a sudden my stool looks like it's a tiny little pencil, and every time I go to the bathroom it's a little pencil coming out. Something's different. Get checked.
Okay.
Get checked. The key thing is get checked.
Yeah. Gotcha. Okay, so with the pandemic,
Here we go. Pandemic.
A lot was going on.
I thought we weren't talking about pandemic.
No, we're not going to talk about that. We're not going to talk COVID. We're going to talk about the result from COVID.
Oh yeah.
Which was a lot of stress.
Yeah, it was.
A lot of stress.
And it's still a lot of stress.
Right.
Yeah, but at least before you could get out the house and cool off or go see your girlfriend or whoever else, right? But have you noticed an uptick in your practice as far as people coming in stressed?
Oh yeah. And the stress takes on so many different forms, right? So we've definitely seen an uptick. As if you look in just generalities and look at the whole country, a whole lot more depression, a whole lot more anxiety, and it's not just elderly people who may feel shut in and nervous because they're at highest risk. It's teenagers, all right? Everybody's got anxiety because think about it. Look how much has changed.
Right. Absolutely.
A year ago, we're April, whatever, 7, 6, I don't know what today, but look how much has changed in 1 year, and look how much has been different for whatever age you are.
Right.
So I've seen a lot more stress and anxiety. I've seen a lot of people putting off some of these same things that we talked about. Coming to the doctor for colon cancer screening or prostate cancer screening, or having a symptom that needs to be worked up further, but not going to the doctor for fear that you're going to get COVID if you go to the doctor's office. So those things have definitely gone up. And I think I tell people now, I really start a lot of my visits in saying, make sure that you're staying physically, mentally, and spiritually well. because we got to do that. You got to find ways to deal with the stressors that this whole pandemic has put on everybody.
Right.
Every time you turn on the news, even though now people are getting vaccinated, I think they said like 20% of the U.S. adults are vaccinated now. You still then, you know, the story right after that is, but cases are going up, and more people are in the hospital than a week ago or 2 weeks ago. So you have to find ways to separate yourself too, to deal with that stress. Because that stress can be just as deadly as some of the same things we spoke about.
That's a silent killer right there.
It's a silent killer.
Yeah.
Right.
And
But-
what the stress will do.
So is hypertension, is that stress? Or is that something different?
Hypertension can be exacerbated and
Okay.
made worse by high stress. I don't think the stress alone is the direct culprit, but I think if I'm one and I'm kind of borderline and now I'm real stressed out, I'm sure my blood pressure is going to be a whole lot higher.
Okay.
But do people really know they stress or have anxiety? Or I don't think people really know they're going through things.
I think some people are very good at saying it,
Uh-huh.
and then other people not so much,
Mhm.
and other people may manifest it in a different way.
Okay.
Right? So, I mean, you may come to me and say, Dr. B, my stomach hurts all the time. It hurts all the time. I'm waking up. I got the runs. I got this. I got that. And that may be your manifestation of stress
Okay.
on you.
Okay.
All right? That you just not really processing like, yeah, my stress level now has me feeling this kind of way physically. Right? Yours may be something totally different. Headaches.
Right.
Doc, I got headaches all the time. I'm gonna get me some new glasses. I'm gonna do this. I'm gonna do that. Maybe your stress is more of a headache manifestation, right?
Right.
So I think it's a tricky thing to put your finger on for me and for the patient.
Right.
So you talked about symptoms. Why is it whenever I have a symptom, if I look it up on WebD, it always comes back cancer?
Because cancer can be anything.
Anything.
Because cancer can be because they want you to go get checked out.
Yeah.
So is WebMD helpful?
Oh man, it's helpful, but I tell you, when people come in like, Doc, here's what I saw on WebMD. The first thing I'm like is, really, really, because every diagnosis on WebMD. Don't get me wrong. Anybody watching this who works for WebMD, I'm okay with WebMD, but don't let WebMD take the place of talking to somebody.
Right. Okay.
All right, because anything you look at on WebMD, the top things are going to be bad.
Yeah. It's always like that.
It's going to be bad.
Man, it's a bad
Yeah,
situation.
I ain't got much time left.
Right.
Oh man.
And you
So
got
true.
another statistic over there.
Nah, I don't know if this up your alley though, Doc, but I was gonna try to talk about black male suicide rate. I didn't know it was real high, but it's like in the top 10 of black men dying.
Wow.
Suicide rate.
Yeah.
There's one of the causes.
Yeah,
one of the top
one of
10
the
causes.
Top 10 causes. What are you have all the causes right there?
Yeah, I have a few. Here go a bunch of the causes. So,
Heart disease. We'll read these off from
one that,
number 1 to number 10. So heart disease, cancer, which encompasses all those things, unintentional injuries, homicide, stroke, diabetes, chronic lower respiratory diseases. That would be asthma, COPD, which is pulmonary disease, usually caused from smoking, kidney disease. Septicemia means bacterial infection that gets overwhelmed and shuts your organs down. And then hypertension. So we're putting unintentional injuries as the suicides?
I don't know, but the suicide rate for men that's between the age of 15 and 24
It's high.
It's the third leading cause of death
Yeah.
in black males.
It's high. I don't even think we have enough time to even talk about all the issues that are happening in that population.
Yeah.
And we hit on stress.
Mm-hmm.
We hit on disparities access to things that we all made us take for granted. We hit on feeling marginalized,
Right.
right? That I can't win no matter how I do this kind of thing. I think there are a lot of pressures from the devices in terms of making people feel either not even bullied, but just like can't live up to what everybody
Trying to
else.
compare
Keeping up with the
themselves.
Joneses, right?
Keeping up with the
Yeah.
Joneses.
Keeping up with the Joneses.
They want to like.
And I think it's rough. I think it's a really rough time.
So
That window.
are there times when you say, look, man, you know, I believe whatever you're telling me you feel in or whatever, but from an examination standpoint, it's really nothing here. Maybe you should see a therapist.
So I think so too, and I think that is an interesting thing because us as men and us as black men, that's just not something that we've been accustomed to doing,
Right.
right? We don't want to talk to a therapist. How are we going to do it? We're going to handle it on our own. We're going to bottle it up. We're going to go out and do something out, play ball. We're going to go talk to our girl, or maybe not even those things. Maybe sometimes we're going to hit the bottle,
Right.
or do something else, hit the
something
drugs.
else.
So we, as a people and as a culture, or another big outlet for us is church, right? We may go talk to the pastor, we may go pray about it, or may have other people pray about it for us. But I think that all those things help. Not the bad things, but the
Right.
prayer and reaching out. But I think that there are plenty of times that we need to reach out for professional help.
Right. Yeah.
And not feel that stigma that says, oh man, if I'm having to reach out for professional help, there's something wrong with me inherently. No. Because I think all of us go through periods where we need help.
Yeah.
Yeah.
We need to lean on somebody,
Yeah.
and I think making sure that that is acceptable, right? We've done that in our church a few times, is let the youth groups know that these type of negative thoughts, we all get them, but sometimes they can get to a point where, whoa, these thoughts are really strong. And looking for warning signs to say, we need help. And it's not anything to be ashamed of to admit that you need help.
Right.
And us as parents, right? You a parent?
No, sir.
All right, not you. But us as parents,
Right.
knowing to look for things in our kids that could be warning signs that they may need help but are not asking for it.
Right. Yeah.
It's tricky.
Yeah.
Yeah.
It's
it
tricky.
is. Yeah.
And the influences come from outside.
You're right.
Yeah.
That's I think a big part of the problem is the influences are coming from
Right.
sometimes other than mom and dad and pastor
Right.
and our community that helps to raise us.
And like you
Coming
say,
from,
you
coming
would
from
know
Instagram.
it. Exactly.
Coming from this.
Yeah, you would
You
know.
know?
Yeah, that was
Because
surprised.
it's crazy, like you mentioned the word bullying, right? So when I hear about somebody harm themselves or they felt some kind of way because of what was said to them on Instagram or text message or whatever
Sure.
else, in my mind I'm like, well, just don't go back to that platform or don't block the text or whatever. But I have to remember that I can remember a time when phones weren't around, when cell phones weren't around. But now the generation now, that's all they've known.
That's all
It's
they know.
all they know.
Right, it's all they know.
That's
So
all
they
they
don't know it. They think it's like the end of the world if somebody.
Right. It's like going outside for us.
It
Right.
is.
We
It
couldn't go
is.
outside. It's like
And the power of the like, right,
Yeah,
is intense.
right,
It's intense. All you have to do is hang out with some younger generation folks, and you got to get that perfect picture and do this and do that and perfect post to get the likes. And if it doesn't get that response, a lot of folks will internalize that as, uh-oh, I'm a little bit of a failure.
Right.
No one liked my picture. No one liked my post. So, it's a very, very tricky situation to navigate that I feel that we have a lot of work to do to start to change that mentality, to have people be more individual thinkers and not necessarily feel that there's that pressure to fit in so bad
Right.
that you would be willing to hurt yourself or something if you were not
Right.
conforming the way that you feel that you should.
Yeah. Yeah. I agree with that.
Yeah, man.
Yeah. I think
It's
that
scary.
Yeah, it
I
is.
think people have to learn that whatever X person is doing, I don't necessarily have to follow that path to
Right.
be. Everybody got a different path,
Absolutely.
And if you do
Absolutely.
something different, that's fine. But a lot of times, on social media, well, if you're not doing X, Y, Z, then you're not this.
Absolutely.
Or if you are doing X, Y, Z, you can't obtain this. But it's a different
And I
way
think-
for everyone.
And I think also keeping in mind that what I see on social media, there's no percentage, right? But I would venture to say more often than not is not reality.
Not
Right.
reality, yeah.
All right, so I see, oh, now look at that dude. He's out living his best life. That guy's on vacation. This one's here. This one's that. This one's that. And then you feel like, man, I'm not good enough.
Yeah.
Right.
Right.
Don't let what somebody else's reality or perceived reality is affect you to the point where you feel like you're not living up to that.
Yeah.
That
Yeah.
pressure to conform is rough, man. It's just now taking a different form.
Right.
Mm-hmm.
It's taking a different form. Before it was who a car with this, that. Now it's like it's in your face all the time.
Right.
I think they don't realize how long they have to live too. The
Yeah.
kids don't realize how long they have to live. They got a long time on this earth.
Yeah, man. The other thing I think about sometimes too is that, and I think this is a big problem and a big reason why we see some of these things, especially in that generation, is that when we came home from school, right? Let's say me and you were at school and we had beef, right? We're playing ball and game didn't end well, and I'm like, man, forget that, whatever. I go home, you go home. We may not see each other again until tomorrow at school.
Right.
Right? Now, I'm constantly in contact. I am never away from you.
Right.
Ever.
Right.
Right?
Yeah.
Because now you can start posting something and I can respond back. And there's not.
And then
there's
other
not-
people can chime
And
in.
other people can chime in.
And
get
other people reposting it.
And then
sending it
repost.
to-
Exactly.
yeah.
So there's not that downtime.
Right.
I never thought about
There's not that downtime, right?
Yeah.
If I wanted to reach out to you before, I had to like pick up the phone, call you, and I'm sitting in there in the kitchen and I'm talking to you, and everybody's right around and the whole bit. But now you can escape to your room and just be constant. There's not that downtime, and I think that downtime we all need a reset.
Right. Yeah.
We all need a
definitely
reset.
Yeah, never thought about that.
So
Yeah.
Yeah,
it's good stuff, guys.
yeah.
What else? You got anything else, Ant?
No, sir. We can close it.
We can close it out. We appreciate you, Dr. Bourne. I
Hey.
ain't gonna do the first name again.
Yeah,
gonna say Dr.
Evan.
Ebon Bourne.
Evan Bourne.
Now this has been good, guys. I love this type of. I think this forum is good too because it's just conversational and it's it's just real.
Yeah. I
It's
would
just
say if
real.
anybody need a doctor, see him, but then I might
Nah,
not
then you won't be able to get in.
Then I won't be able to get in.
It's crazy.
and we kept the mask on
Yeah.
to show y'all we're still trying to do the right thing
Right.
with social distancing and keeping our mask on and not put out the wrong message out there. So yeah, I appreciate you guys for having me on the show.
Yeah.
It's been
Thank you for
it's
coming.
a great experience for me too.
Yeah.
We
Appreciate you.
it.
Absolutely.
Yes, sir.
All right.
All right.
All right, that's it for We the Blueprint. Be sure to subscribe, like, share. We're trying to get our numbers up. We the Blueprint, and we out.